Chapter 6, Chemical Examination of Urine. So commercial reagent strips are routinely used for chemical analysis of urine. Reagent strips enable us to do some rapid screening of urine specimens for the following types of chemical analytes: pH, protein, glucose, ketones, blood, bilirubin, urobilinogen, nitrite, leukocyte esterase, and on certain test strips, specific gravity. So a reagent strip is an inert plastic strip onto which reagent-impregnated test pads are bonded. Chemical reactions take place after the strip is wetted with urine, and each reaction results in a color change that can be assessed visually or mechanically. By comparing these color changes with a color chart supplied by the manufacturer, qualitative results for each reaction are determined. So reagent strips are sometimes called dipsticks. They're examples of state-of-the-art technology. So before the development of these dipstick tests, all chemical tests on urines were performed individually in test tubes. But now, these strips have significantly reduced the time required for testing, reduced any cost in relation to reagents and personnel, and enhanced test sensitivity and specificity, and decreased the amount of urine required. Now let's talk about the quality care and storage of these dipsticks. So all of the reagent strips must be protected from moisture, chemicals, heat, and light. Any strips showing any evidence of deterioration, contamination, or improper storage should be thrown out. The tight-fitting lids, along with a little desiccant or drying agent pack, must be within the product container to help eliminate any kind of deterioration on the pads due to moisture. Reagent strips should be stored in their original containers at temperatures below 30 degrees Celsius. They are stable until their expiration date, indicated on the label. And to ensure accurate test results, all reagent strips, whether from a newly opened container or from one that has been open for several months, must be periodically tested for the appropriate quality control. Now, if one of the reagent strips comes up positive, we do have some confirmatory tests that are either tablet form or liquid form to confirm that the actual substance is positive and there's no interfering substances. So there's also some controls and storage things that we need to handle for these tablet and liquid chemical tests. They must be handled and stored according to any insert provided by the manufacturer. They are very susceptible to deterioration from light, heat, and moisture, so they really need to be visually inspected before each use and discarded if any of the following changes have occurred. If the tablet is discolored, contaminated, or any spoilage is evident, past the expiration date, or incorrect storage, it must be thrown away. To ensure the integrity and appropriate quality control must also be employed. So box 6.1 talks about the appropriate reagent strip testing method. So the room must have good lighting because you have to see the color change. You want to prefer fluorescent bulbs and avoid direct sunlight, and hopefully your urine is at room temperature. You want to use an uncentrifuged urine and mix it well. Dip the reagent strip briefly into the urine to ensure all of the pads have been wet, and then remove it with the excessive urine edging on the side of the tube, and then you can begin the timing device. Once the appropriate times have been reached, you're going to read the result of each reaction pad using the color change on the container. Once all of your readings are complete, please discard the strip into biohazard waste. Now, why do we do the confirmatory tests using tablets and liquids based on our urine dipstick results? Well, first of all, we want to confirm that the results we obtained by the reagent strip are true and they're not interference that's causing them to change. Alternatively, for highly pigmented urine that may make the reagent strip result more difficult to interpret, this will provide a confirmatory test. Now, some tests are more sensitive than the strip, just like the icto test for bilirubin. So this can be used to definitely identify what the actual quantitative values are. Especially test specificity differing from the test strip can also be used to test certain substances such as protein. So let's talk about the strip and all of the tests, its clinical significance, and its principle. So with specific gravity, it's a property of the urine expressed of solute concentration. So the significance here, the ultrafiltrate that enters the Bowman space of the glomerulus has the same specific gravity as protein-free plasma. So as the ultrafiltrate passes through the nephrons, solutes and waters are selectively absorbed and secreted. So if the tubules are unable to perform these functions, the specific gravity can be identical to that of the filtrate. And this is a condition that starts to become pathological. So we really need to see if the kidneys can excrete the solutes necessary in the amount of water that is needed by the body. So the principle here in the reagent strip, it does not measure the total solute content, but only the solutes that are ionic. So keep in mind the only ionic solutes indicate the renal concentrating and secreting ability of the kidneys and have diagnostic value. So the reagent pad is impregnated with a polyelectrolyte and a pH indicator. So when it's dipped into the urine, proteins are released from the polyelectrolyte in proportion to the ionic concentration present. The release of these protons change the pH of the test pad, resulting in a color change. Now the kidneys play a major role in regulating acid-base balance of the body. The renal system, pulmonary system, and blood buffer provide the means to maintain a balance at a pH compatible with life. So urine pH can affect the stability of formed elements in urine. So at alkaline pH enhances lysis of cells and degradation. Because pH values greater than 8 and less than 5 are physiologically impossible, they require investigation if they are observed. So really, the urine pH provides valuable information for assessing and managing disease and for determining suitability of a specimen for chemical testing. So the method for the reagent strip uses a double indicator system based on bromelain blue and methylene red. So it produces a color change from orange at a pH of 5 all the way to green up to a pH of 7 and changes to blue at a pH of 9. So when we talk about blood can enter the urinary tract anywhere from the glomeruli to the urethra, or can be a contaminant in the urine as a result of the collection procedure used. So even small increases in the quantity of red blood cells in urine are diagnostically significant. So numerous diseases of the kidney or urinary tract, trauma, drug therapy, or strenuous exercise can lead to hematuria and hemoglobinuria in presence of blood in the urine. So here, the chemical principle is a lysing agent that uses that detects pseudoperoxidase activity in the heme moiety. So the reagent pad is impregnated with a chromogen, tetramethylbenzidine, and a peroxide. Through pseudoperoxidase activity, peroxidase is reduced and the chromogen becomes oxidized, producing a color change on the reaction pad from yellow to green. Results can be reported as negative, trace, small, moderate, or large, or using a plus system. 1 plus, 2 plus, 3 system can be used. Now for blood, ascorbic acid is known as a big cause of interference, and it can cause the reaction to become a false negative. So we only see this because when we go to our microscopic findings, we find a negative reagent strip test result with intact red blood cells. So here we would confirm that there is some kind of interfering product on their chemical reagent strip. Now normally a few white blood cells or leukocytes are present in the urine, usually 0 to 8 per high power field. The number of white cells per microliter varies depending on the procedure used to prepare the examination, but increased numbers in urine indicate inflammation, which can be present anywhere in the urinary system, from the kidneys to the lower urinary tract. The presence of approximately 20 or more white cells is a good indicator of a pathological process. And increased numbers of white cells are found most often in urine from women more than men, in part because there's a greater incidence of urinary tract infections, but also because of the increased potential for women's urine to be contaminated by vaginal secretions. So the method of the reagent strip detects leukocyte esterases that are found in the granules of certain types of white blood cells. These granules are present in the cytoplasm of all of the granulocytes. So those are specific cells called neutrophils, eosinophils, and basophils. Monocytes and macrophages as well can also be detected. So the reagent strip does not detect any kinds of lymphocytes. So here's the advantages to using leukocyte esterase. It has the ability to detect the presence of intact and lysed white blood cells. It serves as a screen that's independent from sediment preparation. So all strips for leukocyte esterase detect the action to cleave that ester. So it's impregnated on the reagent pad to form an aromatic compound, and immediately after hydrolysis of the ester, an azo-coupling reaction takes place between the aromatic compound produced and a diazium salt on the test pad. The end result is an azo dye with a color change of the reagent pad from beige to violet. Now, routine screening for urine nitrate provides an important tool to identify urinary tract infections. A urinary tract infection can involve the bladder, the renal pelvis and tubules, or both. Two pathways for the development are the movement of bacteria up the urethra into the bladder, or the movement of bacteria from the bloodstream into the kidneys and urinary tract. Now, the screening test for nitrate does not replace a urine culture. It can also specifically identify the bacteria present. So it provides a rapid indirect means of identifying the presence of only nitrate-reducing bacteria in the urine at minimal expense. So up in the top corner, you have a little chart that can help you diagnose if a patient does have a possible urinary tract infection. So with nitrite being positive and leukocyte esterase being positive, you can assume that the patient has a probable urinary tract infection. Now sometimes when you have a nitrite positive and leukocyte esterase negative, this can be due to the low number of leukocytes present, but still you might have a probable urinary tract infection. So if you don't have any nitrites produced, but you have leukocytes, this may or may not be a UTI because, again, leukocytes are seen in other types of inflammation. Now, if you have both of these tests being negative, you may not have a UTI. So normally urine contains about 150 milligrams of protein each day, and it originates from the ultrafiltration of plasma from the urinary tract. Now proteins with a low molecular weight pass through the glomerular filtration barriers and are reabsorbed. Because of these concentrations, only very small quantities of the proteins appear in the urine. But in contrast, albumin, a moderate molecular weight protein, has high plasma concentrations. So this fact combined with the ability to pass through the barriers account for a small amount of albumin present in normal urine. The presence of increased amounts of protein, called proteinuria, is often the first indicator of renal disease. For most patients with proteinuria, the protein present at an increased concentration is albumin, although to varying degrees. Let's talk about its principle. When the pH is held at a constant buffer, certain indicator dyes release hydrogen ions as a result of the presence of those proteins, causing a color change. The reaction pad is impregnated with a buffer and it maintains the test area at a pH of 3. So if protein is present, it acts as a hydrogen receptor, accepting hydrogen ions from the pH indicator, thereby causing a color change. The intensity of the color change is directly related to the amount of protein present and can change the color from yellow all the way to blue. Now, the presence of glucose in urine is termed glucosuria. When these non-sugars or combinations of sugars are present, the term is glycosuria. All glucose that passes through the glomerular filtration barrier is actively reabsorbed by the tubules. However, if the reabsorption of glucose passes the maximum amount, then it would spill over into the urine. Now, glucosuria is caused by a pre-renal condition, usually hyperglycemia, or a renal condition, defective tubular absorption. Diabetes mellitus is the most common disease that causes hyperglycemia and glucosuria. For its principle, the glucose reagent strip uses a double sequential enzyme method to detect only glucose. Glucose oxidase is impregnated on the reagent pad and rapidly catalyzes the oxidation of glucose to form hydrogen peroxide and gluconic acid. The hydrogen peroxide oxidizes the chromogen on the pad in the presence of peroxidase, and the color change observed depends on the chromogen used in the reaction and varies with the brand and can change from a bluish to a greenish brown. A Clinitest tablet is used to detect any sugars as a copper reduction method. Glucose, fructose, galactose, lactose, maltose, and pentose are a few of the reducing sugars. Also used as a means to detect or prevent any kind of interference, this as a confirmatory test. So copper reduction tests are based on the ability to reduce substances to convert cupric sulfate to cuprous oxide, which results in a color change from blue to green to orange. Are byproducts or intermediate products of fatty acid metabolism. Normally, the end products of fatty acid metabolism are carbon dioxide and water, and no measurable ketones should be produced. However, when carbohydrate availability is limited, the liver must oxidize fatty acids as its main metabolic substrates, and as a result, large amounts of these ketones are formed. The main causes are the inability to use carbohydrates and inadequate carbohydrate intake or a loss of carbohydrates. By far the most common clinical presentation is seen in patients with uncontrolled diabetes mellitus. In these patients, the body is unable to use carbohydrates and fat metabolism increases dramatically. So, the principal method is based on a nitroprusside reaction with sodium nitroprusside impregnated in the reagent pad. In alkaline medium, this acetoacetate reacts with the nitroprusside to produce a color change from beige to purple. In healthy individuals, the only trace amounts of bilirubin are excreted and usually not detected by routine methods. So thereby, any detectable amount of bilirubin is considered to be significant and requires clinical investigation because it indicates a disruption or increase in the breakdown of hemoglobin. The reagent strips for bilirubin are based on the coupling reaction of a diazoammonium salt impregnated in the pad with bilirubin in an acid medium to form an azo dye, azobilirubin. This azo coupling reaction produces a color change from light tan to beige to pink. Normally, there is a small amount of urobilinogen present in the urine. It is enhanced in types of alkaline urine, so the best specimen to choose is either a 2-hour collection after a midday meal. So the methodology talks about the reagent pad, which is impregnated with Ehrlich's reagent, which is a p-dimethylaminobenzoaldehyde, a color enhancer and an acid buffer. So as urobilinogen reacts with the Ehrlich's reagent to form a red chromophore, the reagent pad changes from light pink to dark pink. Most tablets use the same types of principles as the strips, and some have modifications. So there is the acid test and the icto test as confirmation tests to certain chemical strip pads. Acid precipitation for protein detects albumin as well as other proteins not detected on the reagent.